You've been talking with me about how healthcare administration is a passion for you.
Yes, indeed. The people that we serve through the Medicaid program, 2/3 of Medicaid spending generally go to the most vulnerable people among us, people with disabilities, low-income seniors. So Medicaid really is different programs for different populations, and it has been made much of my career trying to improve the programs so that they keep pace with the people that we serve.
And the Medicaid programs are different from state to state, too.
Yes, indeed it is. And that is really what has brought me here to Florida to talk about the new opportunities and challenges of looking at Medicaid through a different lens now. And every state has to do it their own way, and Florida has to find its way.
Well, you helped the state of Florida do Medicaid the way it's doing it now by helping to negotiate a waiver with the current administration, federal administration, in terms of the delivery of Medicaid. That waiver, or part of it anyway, it's just been renewed, but part of it's about to run out. Tell us where that is now.
Well, it's hard to believe, but it's been almost 10 years since I was in President Bush's administration running Medicaid from the national level, working with Governor Bush's administration to create the waiver in the first place. So it has been almost 10 years.
Tell us about what the waiver means. It's a waiver to do what?
It's very important for Florida as it was modernizing its Medicaid program. And one of the things to keep in mind, one critical thing that we put into that waiver was something called the low-income subsidy pool. And that pool, and again, as Florida talks about Medicaid and serving the new populations, they have to realize you're already serving many of these low-income, childless adults, low-income parents of children who are already on Medicaid. You're already serving them, but you're serving them through the provider system, paid for with funds out of the low-income pool. In the most recent extension of the waiver, that was done for the entire program for another 3 years.
And that's a Healthy Florida Works.
That's a new idea. That's correct.
Okay.
That's a new idea.
Okay.
But the current waiver of Medicaid managed care, basically, and it was Medicaid reform when we negotiated the waiver 10 years ago. That waiver, the low-income pool was extended for only 1 year. So Florida is going to lose those funds that is being used to serve some of this low-income population already.
So there's some pressure there that's kind of hanging over the system. All that money might go away. Do you think that there may be some leverage there that could be utilized in discussions between the state and federal governments over the future of Medicaid coverage?
Well, as someone who follows Medicaid very closely, you can't help but think that the Obama administration didn't have a very purposeful reason for not extending the pool. So I think those will be part of discussions.